All right. Welcome everyone to our live interview. I'm super excited to introduce my friend Rita. Rita is 73 years old. She's got four grown children, five grandchildren, and two great grandchildren. My goodness, when you look at Rita, you probably are like me and going like, how the heck you don't look 73 at all. You look amazing. This is
Oh,
amazing.
thank you.
And so you worked in radio for years, advertising and
Mhm.
marketing. You retired at 70, and now a couple years after that, you're like, I miss people. I want to get back in there and do something. And that's how you found our company and our products. But we're here today to share a little bit about your journey with hormone therapy and with this new product that we launched this year to help women in the perimenopause, menopause, and beyond season of life. And so I'm going to ask you a few questions and I'm going to get you to share your story. But before that, I want to back it up a minute before all that. And I want you to share your story that you shared with me about your leg and what the doctor said and what happened and what was that first product that did this because it's my favorite
Ah,
product. I have to talk about it. So share
Okay.
what happened there.
It's kind of funny because when I stumbled onto this company, I was actually looking for something to help my hair because my hair was thinning at a terrible rate. I had actually gone to California and met with a gal who did hair toppers for oncology patients, and she fit me for a hair topper. So I came back and nobody knew I was wearing it. I had a bald spot in the back of my head. So I stumbled on the Glow collagen and I thought, well, I've tried collagens for over 6 years, and this is another collagen. I guess I'll just give it a whirl. And so I was taking it, and my hair came back. And so I was excited about that. And I retired my hairpiece. But the funny thing was, I also had a Baker's cyst. I'm a heavy walker and I walk hard on my feet. I really do walk too hard. But so I developed this Baker's cyst behind my left knee. And after a few months, I did seek out help for it. And I was told that it's just one of those things. It's a fluid that just sits back there. And it was as big and hard as a rock and really painful. So I was trying all sorts of things. But in the progression of me taking the Glow Collagen, our Glow Collagen for my hair and getting great results, I realized that 6 weeks in, my Baker's cyst was gone. And I didn't even think about it. It was like,
Right?
oh my gosh, I am walking the same as I've always walked now. And I have no pain. There is nothing going on back there. And so it was like two wins, two big wins for me.
I
Sally, my hairpiece is in a drawer, and my Baker's cyst is no more. So,
I love it. I love it. Okay. I love when you shared that because oftentimes we get told there's nothing you can do. And when they say, I just want to point this out, when doctors say there's nothing you can do, what it actually means is there's nothing I can do. It does not mean there's nothing you can't do to get rid of it. It means the doctor does not have anything in the doctor's toolbox that can help you. So whenever you hear the words, you can't do anything about it. You have to live with it. My message here right now is no, stop in your tracks. What they're actually saying is they don't have any tools in their toolbox for you. It doesn't mean that there's not tools out there that can help you. And Rita is a perfect
Mhm.
example of that, right? And so oftentimes as we get into menopause, we're told the same thing
Mhm.
told the same thing. And for some women, they go on hormone therapy because that's the thing. Some women can't even be offered hormone therapy because of the high risk factors if they have genetically more predisposed to estrogenic type cancers and stuff. They are not even allowed to touch hormone therapy. So that's really something to note also, right? So if you are
Mhm.
someone in that position, we need to chat, or you need to chat with whoever invited you to come listen in on Rita's story, because it's really important. We do have tools in our toolbox aside from what you're being offered at the doctor's. So there's a couple of things. There's those, and then what I'm reading a lot about is about the bioidenticals. So the bioidenticals is what Rita was on for 10 whole years. Okay, but I'm going to have her share that story. But before that, I want, if you haven't seen my post from earlier this morning, you'll see some of the risks that come with these hormone type treatments, blood clots, cancers, like all kinds of things that you don't want, but like you also don't want to live with the symptoms because that can be
Mhm.
really miserable. So, Rita, share with us your story of how you entered into this and how you ended up on bioidenticals, and then that journey forward, and why you decided to come off of them, and then this thing arrived in your lap after. Like you didn't go off of it because this was around. This
No,
happened to land in your peripheral after you had already decided to go off. So, okay, go ahead. You
right.
take it away.
Okay. Well, I entered menopause, or I didn't even know I was in menopause until everything stopped. And then all of a sudden, it just was like an onslaught. I had the hot flashes, the night sweats, irritability, my mood swings and things like that, not sleeping good at night. The whole ball of wax came all at once. And I was like, what am I going to do? What am I going to do? So I went to the doctor, and thank goodness, she said, yeah, we can do something. And so I actually was on bioidentical hormones for 10 years, which worked. They worked. I'm not going to say they didn't
I want to
work.
pause for a minute because
Okay.
I think it's important. Something you had said to me, you were like, bioidenticals. I thought it was like
Oh
natural.
yeah.
And then
I
you
thought it
learned
was
it wasn't.
natural.
So be
I
careful
thought it
with
was,
language, right? It's that
yeah,
language. Sometimes we interpret things as we want them to be, not as
sure.
they are. And so bioidenticals are not natural. They're lab made. They're made to be similar, but not exactly.
Thank you for that, because I forgot about that. But that's true, because you do, when you start on something, especially when the word is bio, it's like, well, bio, that's me. That's it's going to be identical to me. But
It is with
um,
intention they do that. It's a
okay.
great marketing word.
But because of some things that happened in our family history, I took a real hard look at what I was putting into my body. I had started with Trinant, and I just figured, all these good products, I can't be putting this stuff back into my body anymore after I realized what was taking place. And I won't go into that part because it involves another person in my family, but I just want to let you know that you really do want to look hard and close at what you put in your body. So I stopped. I actually weaned myself off of the hormones back in November. And believe me, okay, I was 72 at that time. Everything came within a week. Everything came back full bore, full bore. In fact, it came back worse than it was before I started on hormones. So the hot flashes during the day, yep. Night sweats, horrible night sweats. I mean, I would have to get up and change my t-shirt twice during the night. It was just really bad. One thing that really came that I noticed that I didn't like about myself was I caught myself being very snippy, very not nice, very unkind. And that's not my personality at all. And it was like, I cannot, this is not going to be good for me. How am I going to do this? And lo and behold, I was so excited because that was November of 2024. In March of 2025, our company came out with a product called For Her. And I was like, oh, thank you, Lord, just for me. And so I did. I started on the product, excited, very, very excited to be able to take it. And I had done all the data research because I'm a big researcher. So I looked at all the clinical data behind it, saw how it worked with other test groups and things. And so the Estrel G100 has got amazing things about it. But anyhow, I used it religiously, very systematically for the 3 month period of time. And I noticed the irritability, that whole mood swing thing, that was gone. The hot flashes during the day, that was pretty much taken care of. But the night sweats, I could reduce them, but I couldn't get rid of them. So what I did is I did an experiment on myself because I've taken supplements for since I was 29. And I feel very comfortable in doing that because I just increased the dosage a little bit. And so what I did was I started taking one in the morning, one at lunchtime, and two at night. And I also take Optimize at night because I walk a lot and I'm hard on my body, and that just helps to relax and repair. And so what I found, and this is over a 2 week period of time, my night sweats are gone. I was so, I'm not going to use that word, but I was so darn excited. I couldn't hold it in. And before I said anything to anyone, I contacted Jen because I just said, okay, this is what's going on. This is what I did. Is this kosher? Is this okay? And she came back and she told me, yes. And so I was so excited because you know what it's like to have your life back again, to be able to sleep all through the night. And I mean, I go to bed and I'm knocked out till the next morning. I sleep like a baby. So
Good.
there's got to be other people out there like me. I just can't believe there
Right?
aren't.
Right. Sometimes it does matter with dosage. And one of the things that I love about our products that makes it set apart from so many other brands. I mean, there's lots of things that set us apart, but dosage matters. And we have dosages that are going to provide those clinical results. So for her is two a day for those clinical results according to the clinical studies. But for some people, like Rita, who's been on bioidenticals, so there's been some hormone fluctuations, and she has like when it hit hard. Like a little bit extra can change that, right?
Mhm.
And so I don't recommend anybody go beyond two, like doubling a dosage that's recommended, without a professional support and help with that, okay? But I think that sometimes our bodies just need a little more, and I think that we need to trust our bodies. We need to listen to our bodies. And I want to be clear, though. I do want to be clear that we're not recommending people go off their hormone therapies. Talk to your doctor, do what's right for you. I am all about personal autonomy, and you have the authority over your body, number one, over anybody, over a doctor, over anything. You always get to be the one to decide what's best for you. So I do want to be clear about that because for some people, like I believe that it should be everybody's choice. I just don't think we're always told about the risks and we're not told about all the options. And so the purpose why I asked Rita to come on and share is because I want people to understand there's options beyond what might be shared online, what your friends might be talking about, what the doctors might tell you about. There's a broader spectrum of options that are available. And so this has been phenomenal. But what I love so much about it is there's nothing else in it. There's no additives, there's no fillers, there's no chemicals. It is completely plant-based. There's the estrogen in it and the ashwagandha. Estrogen is it's three Chinese herbs combined that have been clinically studied and used across seas for years and they have clinical studies behind that. And so when you go look at everything they're doing, and I don't know like how much reading you did read it. Sounds like you did what I
I did
did.
a lot.
I did the reading. And I was like, oh my gosh, they studied all these people and no one
Mhm.
had negative side effects. Like,
And when they did the test at the end on several of the studies I read, they gave the women the option of not using it anymore or wanting it again. And 99.7% said, don't take it away.
right?
So that was cool.
Exactly.
That
Exactly.
was cool.
So that is super cool. I love that there was no weight gain as one of the side effects because weight gain is one
No,
of the things that many people experience. You did not experience. That's
no.
great. But many people do experience that with hormone therapy. So that's kind of, and you need to have like doctors. Yeah, you have to be in the care of doctors to be doing these things. It
Mhm.
requires a lot of checkups, a lot of
Yes.
maintenance, a lot of adjusting of dosaging to make sure you're safe. And there's still risk even with that. And so I love that we have a completely natural formula that can help without the side
Yes.
effects,
Oh,
without the
I
risk,
am so happy.
right? Because there's so many people that are just probably experiencing the symptoms thinking they don't have another option, right? Or maybe the hormones are don't work. Maybe they don't work for some people. We just want everyone to know that there's other options. So thank
Right.
you, Rita, so much for coming
Oh,
here.
absolutely.
I love
Thank
chatting
you.
with you so much.
I just thank you because you're like a great sounding board for me. I mean, seriously, because I don't know, I'm sure a lot of other people experiment with themselves too. And it's like you have the knowledge. So anyone that knows Jen should definitely reach out to her because it's wonderful to be able to get that kind of information and support from a person that truly cares about you.
Oh, thank you so much, Rita. And if you're watching and you're Rita's friend, she's got the goods, you guys. Like, I don't think you maybe understand how good all of these products are. But if someone has shared this video with you, please get back to them and they will hook you up. Or if you want to have a conversation with Rita or me with your friend who shared this with you,
Sure.
we are definitely open to having conversations. We're all about mission and helping and creating impact. And we're on a big mission to impact a billion lives for good. And so here we go. We're just getting started. So thank you, Rita. Thank you, everyone, for
Thank you.
time to watch our video. If you do have any questions, drop them down below or reach out to whoever shared this video with you. Have a great weekend. Bye bye.
Bye bye.